gives me tremendous pleasure to introduce one of our own, Stephanie George, who is, I'm not going to tell you about the company, I'm going to let Stephanie do that. But I'll tell you a little bit. Stephanie has over 15 years experience developing and funding startup companies through her work with the Emerging Growth Fund in Gainesville, and is the fund manager for the Florida Institute for the Commercialization of Public Research, which she did from 2011 until just recently 2014. Through her role with the Florida Institute, Stephanie reviewed hundreds of seed and early stage companies and closed over $10 million in funding 35 companies. That's great. That's great. Prior to obtaining her MBA, Stephanie had a full career in IT, designing and building enterprise-level multi-protocol and multi-platform networks and service for a software development company, the University of Florida and Shands Hospital. Most importantly, she took home the coveted Stetson from the shootout.
It's right behind you.
And I'm gonna, yeah.
I don't have to wear it during the presentation, but. Good afternoon. I'm Stephanie George, CEO with TAO Connect. And what I'd like to go through in my presentation today is to talk a little bit about the importance of mental health therapy. We really are making a better world. I love saying that. And how, thank you, how TAO Connect, what inspired Sherry Benton to create TAO Connect, the broader vision for what our program can provide, and our initial market and how we're getting into the initial market. So I'm going to start off here with a real case history. This is a young man, and his friends are worried about him. If he's on campus, we need to ask ourselves, does he need to be taken off campus? Is he dangerous? Do we need to hospitalize him? When we talk about mental health therapy, this is a real case. Abraham Lincoln, 16th president. And when we talk about mental health, we talk about everyday people. Oops. We talk about some of our best and our brightest, some of our most productive people. So this is the reality. In the United States, over 44 million people report having mental health issues. This is a huge number and requires a scalable solution. Why do we need to develop a new service? Currently, with effective mental health therapy, we reach about 10%. There's some in the middle who receive some therapy, maybe some medication, but the vast majority of that 44 million received no treatment whatsoever. This is a large problem. So the lifetime effects of depression can be as impactful on health as smoking for a lifetime. If left untreated, episodes of depression and anxiety get deeper and longer and more severe. But if treated effectively early on, those episodes are less severe, and that person can lead a happier, more productive life. So what we're focused on, our initial market, is in college and university counseling centers. And at counseling centers, they feel the need as well. Students who show up may be put on waiting lists. A waiting list may be 4 weeks. And for a semester, 4 weeks is a long time. The first things to go are memory and concentration. And that can really severely impact the semester for a student. For students right now, over half of all students report anxiety. Over 80% of all students report feeling overwhelmed at some point during their college career. These people are suffering. For college counseling center directors, this is a dilemma. When students show up, maybe they get put on a waiting list. Weeks can go by while that student suffers. Alternatively, they can get appointments once every 4 weeks, maybe once every 3 weeks. But it's really hard for you or a student to change behaviors if you're only paying attention to it once a month. So the current system doesn't work for student counseling directors, and they can't hire enough psychologists to work their way out of this. That's how we developed TAO Connect. TAO Connect allows counseling centers to triple the capacity of the number of students who can receive effective mental health therapy at a fraction of the cost, with twice the outcomes for the patients that's on a device in the pocket of every student on campus, available anytime, anywhere. So on the treatment of anxiety, anxiety is an overlearned behavior. It's like a great highway of very well-rehearsed, well-learned responses. It's like hanging your toaster or hanging your smoke detector over your toaster. It goes off at the slightest provocation. So I want you to, so what is an overlearned behavior? This is a little bit of what the background is on what TAO Connect can provide. I want you to think about the last time you drove someplace familiar. Maybe you drove home and you drove to work. How much did you actually have to think about driving? Probably not very much. You've learned it so well that it's become an unconscious activity for you. But to learn a new behavior takes a lot of work. To relearn the behaviors that are alternatives to anxiety responses, oops, wow. Did I go back too far? Okay. It's like learning to drive down a new road because you're creating new neural responses. It's a little rough at first, but with practice you get better. And here's the other thing is with practice, even that muddy road gets better. So learning new responses to anxiety is possible, but it takes practice. So that's what TAO Connect provides. TAO Connect provides high engagement so that the client can practice those new skills to relearn the response to anxiety. They do more time on task. There's interactive, highly engaging video. There are activities that they can do on their cell phone, text message reminders of what they should be doing. And each week they have a 10 to 15 minute video conference call with their counselor. These are all factors that make a huge difference in the outcome. And it reduces the cost per patient to deliver effective mental health therapy. How effective is it? Students who went through the TAO program showed twice the improvement in life functioning and twice the reduction of anxiety symptoms over the same period of time as students who are going through face-to-face therapy alone. We know that face-to-face therapy is effective, and this just enhances that. So in our initial market, we're addressing TAO Connect at colleges and universities. Currently, we have TAO Connect in 12 colleges and universities across the United States and one in Canada. There are 22 million students in the United States. About 7.5% of those students seek mental health counseling each year, but almost a third of them could benefit from mental health counseling on their campus. So the way our business model works, just a little insight into our company, is that the schools will be licensing TAO Connect as a site license for a fee based on the number of enrolled students at their college or university. Their counselors, and this is very important, their counselors will provide the counseling to their students. So we really support and maintain that relationship between the counselor and the patient. We know that that's an important factor in improvement. And then TAO Connect is going to do additional development, support, and training. So as schools stay on our license, they will get the benefit of a better product each year. mental health therapy lends itself very well to a telehealth platform, and there is competition out there. Several of the competitors, eCouch, eMental Health, Breakthrough, they are providing face-to-face mental health therapy, and we know that it works. There's a lot of evidence that face-to-face therapy works. But what they're doing is they're delivering the analog of face-to-face therapy over a digital platform. This is great, but it doesn't expand the capacity of the counselors, and it doesn't reduce the cost to provide services. Alternatively, there are apps. There's an app for everything. You can find apps for mental health. But without the relationship of the counselor, apps have about a 95% dropout rate. So with TAO Connect, we combine all the factors that we know contribute to effective mental health therapy, including the relationship with the patient, apps they can do anytime, anywhere, and so we can increase capacity and reduce the cost of delivering mental health therapy. So back to the broader scope of what TAO Connect can do. Our future is that we can reduce disparities. The fact is, if you live in a wealthy urban environment, your selection of mental health therapy is broad. But if you live outside the urban area, your selection of mental health therapy is very limited. So there's no reason why we have to live this way. We know that it's a wired world or a wireless world. There's no reason why we can't provide effective mental health therapy anytime, anywhere. We want to reach underserved areas. For example, in Orlando, there are lots of mental health therapists, and they're competing for the same patients as all the other mental health therapists in the Orlando area. But by combining TAO Connect with the ability to reach into underserved areas like Leesburg, which is just an hour or so outside of Orlando, but if you need mental health therapy, are you going to take off an hour and drive to Orlando for your appointment and drive home? This makes it possible to provide that effective therapy anywhere in Florida, anywhere in the world. So in our future markets, we're developing additional vertical markets, employee assistance programs, people who don't have time to take off an hour plus an hour appointment to get to an appointment. The broader practicing market for mental health therapists, but we're also developing future treatments. Currently, we have a treatment for anxiety that's highly effective. So we're also developing treatments for depression, body image, trauma. So these are also in our future. But the big thing that we're developing is an adaptive system. As a client goes through the activities in TAO Connect, we keep track at a very granular level of all the activities that they're doing, how long they stay, what they rate highly. We have a star system that's like 1 to 5 stars that they can rate how much they enjoy a particular activity. And so it's like the Netflix of mental health therapy. What you say you enjoy, we can provide more of that. And so mental health therapy has the opportunity to become extremely personalized delivery of therapy. And this is a very important factor and one we know very little about, because currently when therapists know that their therapy isn't working is the first time the client doesn't show up. And by then, we may not have a chance to go back and deliver something effective. So our adaptive intelligent counseling model is also in our future. So we've reinvented the way we deliver mental health therapy. We've included the relationship between the therapist and the patient, activities that they can do anytime, anywhere. We have a weekly outcome measure so we can track progress over time, so we can deliver a more effective mental health model. So on our team, we've got me, and thank you very much for that introduction, Chris. But we also have Sherry Benton, and Sherry has been a researcher and delivering clinical psychology and therapy for over 25 years. So she really knows this domain. Also, we have as a director Richard Allen, who is in the private equity market, as well as having directed many medical and healthcare related startups. So with our financial projections, our initial market is in the college and university market. And we're already seeing traction in that. Of course, we have 12 colleges that are paid betas for our product. And unlike the waiting list dilemma of directors of counseling centers, we too have a waiting list, but that's a good waiting list. We just need to get out there faster so that fewer people need to suffer. But our financial projections also include the private healthcare market, which is the broader market that will benefit from this. We are being funded through both public and private funding. We have investors, and we're also closing in on our first National Science Foundation grant, thanks to Sherry's work, and we're also closing funding with the Florida Institute. So it really does take everyone to build a company that can deliver this. Thank you very much. TAO Connect, we have rethought and we're redelivering effective mental health care that expands the capacity at a fraction of the cost with twice the outcomes for patients on a platform that's available anytime, anywhere for clients. Thank you very much. So if you have some questions, I'd be glad to answer your questions. Yes?
How do you overcome the barrier of the people that have you have to admit you have a problem. Mm-hmm. And so I sort of see where it might go, where you have like mindfulness apps that might work into something larger, but I'm just curious.
Definitely more of a clinical question, and I'd like to ask Sherry to answer that.
The issue for us and for lots of people we talk to is not that not enough people are showing up to get help. It's that we can't possibly serve everyone who shows up. You know, our demand is far outstripping our supply for therapy. So I think that is a huge issue. As we talk to groups like primary care physicians around Florida, what they report is that 50% of their offices are filled with people with mental health problems and they have nothing to offer them other than medication. That finding the resources for mental health therapy is very difficult unless you live in abuse select urban areas. So for us, that's the bigger issue. The other thing is, you know, when it comes to getting therapy, there are inherent barriers. Like there are a lot of people who would be very hesitant to go to their boss at their workplace and say, can I have an hour off work every week to go see my psychotherapist? Where if what you can do instead is 10 or 15 minutes, you know,
schedule a conference room.
Anytime to schedule a video conferencing, it's suddenly much more accessible. So I think what sells it is that it fits your life. It's a lot easier to do. You can avoid having to tell your boss that you're going to psychotherapy if you don't want to. You know, there's a lot of things like that that make it a lot more appealing than traditional psychotherapy. We actually surveyed the students at UF before we built TAO, and it was quite notable that graduate and professional students actually said this would be their first choice for treatment. So.
Yes.
Couple of things. One of them is suppose you have a patient or someone that's using your service that calls every 15 minutes and has a new issue or wants to just wants to visit. And the second is, what if 20 of your subscribers call all at once?
So that's a good question. The video conferencing only works on a point-to-point basis. So the clinician must have the video conference tool open, and the patient must have, and directed at a specific patient, and that patient must get on connected at the same time for them to video conference with one another. So they're not going to just,
It's not random.
it's not random.
Video conferencing is scheduled.
So it's just like a doctor's appointment. So I don't know any doctor that would let you do that. Yes, sir.
With Mary's question, your platform does not address the person that has not accepted a mental illness, knows something is going on. And by tapping into your platform, it assumes that that person has already accepted anxiety or depression or whatever.
Yes.
Yours is not a tool to help that person come to grips with something that's going on.
No, and that's a really good point, because it's maintaining that relationship between the therapist and the client. So the client would have to have some introduction to a therapist. That would have to be the initial engagement. And that therapist would then do a determination if this person is suitable. There's a lot of rule outs, and we want to expand the capacity for therapists.
Well, I understand I can't answer everything, but
Right.
there are an awful lot of people who just don't accept or don't understand that they have a mental health problem. And I teach at a college, and I see it from my students, and from my own experience, I didn't accept my situation until I was 49.
Early treatment is effective, and so
I'm looking to modify your platform so that
we don't identify it. We don't. That's really still the direction that the therapist, the professional, needs to go with their client. And so we don't identify it, but we give a boost to the face-to-face therapy once it's started. Yeah. Yes, ma'am.
I get that the university system is a real attractive first run, if you will, because the numbers are big.
Yes.
And the need is there, but I think you're really on target with the rural application, because there is current funding that is existing, VA funding, and there's a.
The Center for Medicare and Medicaid Services is also,
It's the telehealth
yes.
application is huge. So I encourage you to
Thank you.
keep working in that direction.
Thank you. Yes, ma'am.
I just want to follow up on that observation about identifying. I really see that as the role of the university, that as a communications expert, and I know right now our university spends a lot of time educating students about mental health options, and I think
That was done by Sherry.
there you go. I think as the successes from this program are disseminated as well, as that starts to be communicated and people realize that this service is available and they don't have to go in and there's a low barrier to entering this type of therapy, that in itself is going to help. I know we're all concerned about people going and shoot people on campuses, but I think this, even though the application doesn't directly address it, will address it. And even would be a differentiator when you're choosing colleges for parents of look, they offer this program, so your student is probably safer on this end. Without saying that, because it's a suit, but the implication being, that's too. Don't you think?
I do, and Sherry has years of experience as a director of the mental health center. So, do you have something?
Yeah, I was going to actually, there's other ways to address the identifying problems, and while that's got nothing to do with our company, that's definitely something that was part of my career and my tenure as the director of the Counseling Wellness Center at the University of Florida. The first way that almost any student interacts with us around any concerns about an issue tends to be digitally or through the website. When I came to UF 7 years ago, we had 25,000 visits to our webpage at the Counseling and Wellness Center, and the webpage was god-awful. it was text, 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 text. There was one graphic, which was a picture of the sign in front of Peabody Hall. So our one non-text thing was a picture of text. So we made this very concerted effort to let Google Analytics and a very mindful, deliberate effort at improving our website. And last year we had the Counseling Wellness Center at UF had 450,000 page views on our website. We are one of the most highly trafficked counseling and wellness websites out there. And the average stay on our webpage, on any page on our webpage, was almost 2 minutes, with some of the pages as long as 5 to 6, which is a lifetime in web page development. We also add a lot of interactive self-help so that students who are exploring things like, do I have an alcohol problem? Am I depressed? Have kind of interactive things they can do to work with that, and that was a very common way that people would come interact. So
that also
that's not
addresses
the focus of our company, but that's definitely the focus of especially the Student Counseling Center world, and most definitely at the University of Florida.
Yes, ma'am.
I was wondering, and maybe I missed it, so it provides a platform for conferencing, video conferencing,
And also the activities.
and also the activities.
And
That's what I
education.
thought, and when you said the self-diagnosing activities, that's what I thought. So they can do things, and do they get feedback?
Yes,
The
yes.
therapist gets feedback, but do they get, other than hopefully they're saying, hey, I feel better, I'm not as anxious. But do
Absolutely.
they
So,
get feedback that reinforces this is a real result, you're getting better?
yes, absolutely. And how that's done is as the client spends time doing activities through TAO Connect, our system collects all the use data of what they're doing, when they're doing it, are they going back and visiting it again. So that information gets collected onto a dashboard that their therapist can see each week. And this is a really important factor, because when you know that you're accountable to somebody, you might try a little bit harder. If we all knew that we were going to see the dentist every week, we would probably floss differently. So maybe a little more attention to it. So the therapist can see a dashboard each week of what the client has done on the activities. And there's also the outcome measure. The outcome measure is really important. And they can see from their outcome measure that their scores from week to week are changing. And so that says progress is happening, and that's very encouraging too. So the accountability and the progress measure both contribute to the intentionality. This is a great you guys. Full of questions.
Is that information a medical record that is subject to all of the confidentiality concerns?
Right. We do treat all of the information on a HIPAA compliant platform. So our employees will also go through HIPAA training. So yes, we treat it as information, as personal health information, although we collect 3 items that are technical personal health information. After 90 days of inactivity, all of that data is de-identified. So there's no personal health information connected to an individual after 90 days.
Is there a red flag function to and is it going to develop something like that where you can identify when somebody is serious? I saw that little interactive thing.
Right.
Sure.
So that is actually in our plan for the intelligent counseling model as well, to have natural language processing. There are opportunities for the client to enter journal entries, and we want to use natural language processing to identify trends. So
Yeah, the other thing I want to say is there's a suicide risk, a risk for harm to self and others on the behavioral health measure 20. We send out a note to the counselor if anybody has an elevation in that. So Yes, there,
The
and
counselor is
each-
notified.
Each university puts their own crisis and emergency procedures that they want us to follow. Those are on the front page of TAO for that university. So the other thing that happens is if it looks like a student is in danger, note pops up saying that it looks like they're in crisis and that they should call this number, and so that there's action both on the part of the therapist and the client if anybody is deteriorating.
So over on this side of the room. Well, thank you all very much. I appreciate this.